Okay, so tonight we have some exciting news on the COVID-19 vaccine front. Millions of Americans now eligible for a third shot. The CDC and the FDA both approved additional doses of the Pfizer vaccine. So we wanted to know who can get a booster right now. Here's the info we have for you tonight. The booster must only be given 6 months after your second dose. The CDC is recommending boosters to Americans 65 and older, living in long-term care, and folks who are 50 to 64 with underlying medical conditions. Also eligible for that third shot, 18 to 49-year-olds with an underlying medical condition, and folks who are at risk of exposure because of their job. Now that the CDC is recommending those booster shots, health departments and pharmacies, well, they're working hard to roll those out. But it's a different process and schedule depending on where you live. Here's Jess Arnold to break it all down.
First, these are the groups the CDC says should get a third Pfizer shot at least 6 months after the first two. If you're 65 and older, if you're in a long-term care facility, or if you're 50 or older with underlying medical conditions. Now, these people may get a booster according to the CDC. Adults at a higher risk of catching COVID based on where they work, and those with underlying medical conditions, like Elizabeth in Manassas.
I'm a high-risk teacher, and it was really important to me to get the booster when it was available.
So Elizabeth walked into a Manassas Walgreens Friday, asked if they were offering the Pfizer boosters, and got the shot. Now, it's not available everywhere in Virginia yet, as this Reddit poster discovered. They wrote that they went to the Fairfax Government Health Center Friday and were told they're only offering boosters to immunocompromised people, since the CDC approved that last month. Fairfax County government put out a release Friday saying they're waiting on specific implementation guidance from federal and state governments. So even though you might be able to schedule a booster appointment on Fairfax's website now, the health department says you won't be able to get the third dose yet. They're expecting clinical guidance soon. Virginia's vaccination coordinator said they've been preparing for the rollout and will post more guidance online when it's ready. Maryland's governor directed providers Friday to immediately start offering boosters, so they're available now. You can also get a booster in D.C. now, where the mayor and health director sent out a note recommending it for those who are eligible.
Today, I'm feeling a little under the weather, but no regrets. I'm very happy I got it. It's definitely better than the alternative.
We have the list of occupations considered at higher risk online. Now, the CDC says that could be updated moving forward. We also have some links for you to sign up for an additional dose on WUSA9.com. Jess Arnold, WUSA 9.
Lots of great info. Thanks, Jess. The CDC and the FDA both agree on booster shots for older Americans, but health officials stress this is not going to end the pandemic. That's because of millions of Americans still have not received their first shot. CDC Director Dr. Rochelle Walensky says the boosters will help, but they won't give the U.S. the upper hand on COVID-19.
Infections among the unvaccinated continue to fuel this pandemic, resulting in a rising number of cases, hospitalizations, and deaths.
Well, check this out. According to the data from CDC and Johns Hopkins, the average rate of COVID-19 deaths in the 10 least vaccinated states more than quadrupled the rate found in the 10 most vaccinated states. Think about that for a moment.